Merhaba, iyi günler. I'm Byung Cho, the CEO and President of ExoCoBio. So first, let me get started right away on my presentation. So please let me give you a little slide, a number of slides on ExoCoBio. Actually, ExoCoBio is focusing on specializing in exosome technology, especially to develop therapeutics and drug delivery products. And we hope to be a global exosome leader in this field, especially medical or non-medical aesthetics, actually. So ExoCoBio is one of the top 4 exosome startups in terms of fundraising. And among them, ExoCoBio is the leading anti-aging exosome product. And ExoCoBio was named among top 14 exosome startup. In this article published by Nature Biotech last December, ExoCoBio was introduced as a exosome startup on skin repair. Actually, so far for the last 3 years, we have been publishing 6 scientific papers. All of them are related to skin regeneration or anti-inflammation. Actually, 3 of them are already published, and 3 of them are under revision. And very soon you are gonna see all the publication. Maybe later we can share all the publication in a couple of months later. And in this slide, you can see the Google trend on exosome keyword search. As you can see, for last 15 years, the number of search of exosome has been increased up to 5x. And this is the global trend in exosome R&D. You can see the graph is the annual number of publication on exosome. You can find all the articles and papers in PubMed. And the most important event happened in 2007. Stem cell exosomes were first discovered and published. And what are exosomes? I think most of them know very well about exosomes already. Exosomes are the most important mechanism of cell-to-cell communication between our cells. And we can call exosome avatar or ambassador of our cells. Also, they contain a lot of important message for the communication between cells, as like mobile phones between interpersonal or intercellular communications. This is a simple representation of exosome. The most important key feature is exosomes are surrounded by lipid membrane, and a lot of you can find a lot of proteins inside or outside or in the membrane also, and sometimes they contain a lot of RNAs also. And so when you look at this kind of representation, you can see that exosomes are very similar to our cells actually, but exosomes have a lot of advantages against stem cells, for example. So exosomes are superior than stem cells or consumed media in terms of efficacy, safety, or commercialization and cost. Actually, you can see in the bottom, you can see one comment that exosomes can be purified, stored, and precisely controlled and doses in ways that stem cells cannot. So we can call exosomes are next generation regenerative medicine or regenerative aesthetics. So people can apply MSC, mesenchymal stem cell derived exosomes in various ways, but we are focusing on skin. So exosomes can be applied to inhibit apoptosis of sorry. The apoptosis of skin cells, or promote proliferation of skin cells, and promote extracellular matrix remodeling by exosomes. So actually, a lot of doctors out there in the United States are applying exosomes to regenerate cartilage and to improve pain, or to improve congestive heart failure, and especially for microneedling with exosomes to rejuvenate your skin, actually. And this is a very interesting news, which come out very recently. So one doctor group applied exosomes to cure the one ARDS patient, which is a COVID-19 patient, actually. So when they injected exosomes, stem cell exosomes into blood, the oxygen level had been increased up to 2.5-fold in 12 hours. So as you can see, stem cell exosomes have very strong regenerative activities and a very potent anti-inflammation capability. So we isolate our exosomes from the conditioned media after culturing stem cells, and our concept is very simple. The first one is regeneration, and the second is immune modulation. And we have developed our own exosome purification technology named ExoSCRT. As you can see in this slide, we can purify our exosome from the conditioned media and characterize. And our manufacturing process is very safe and scalable, and which is compliant with the GMP manufacturing process. And after isolation, we can characterize exosomes in compliance with the standard of ISEB, which is the International Society for Extracellular Vesicles. And then we can we did profiling of exosomal proteins. You can find more than 1,000 proteins inside the exosome, and then 180 of them are very functional for skin, such as wound healing, cell proliferation, and anti-apoptosis. And there is another group of microRNAs. We can find about 600 microRNAs, and 100 of them are working for skin. The main function is anti-inflammation, and the other function is anti-itching. So very simply, we can say that we have two molecules group. The first one is growth factors or cytokine, the other is microRNAs. And this is the comparison of exosomes versus stem cell conditioned media. Very clearly, you can see that we are using highly purified exosomes. But other companies are claiming that their conditioned media contain exosomes, but their content is very low. And you can find some guidelines for standardization and quality control around the world, actually. The most important guideline would be the guideline of ISEB, which is the International Society of Extracellular Vesicles. And very recently, the Korean FDA announced the first guideline on exosome therapeutics, actually. So we are meeting those guidelines. And in this slide, in this slide, you can see the quality control criteria, such as quantification, size distribution, identity, and others. And you can see the ISEB guidelines and MFDS, which is the Korean FDA guideline also. And you can see in the third column the markers or examples for the guideline. And ExoCoBio is doing all our best to meet the guidelines to provide effective and safe product. So this part is about the skin rejuvenation or skin regeneration effect by ASCE exosome, I mean adipose stem cell exosome. So in the figure A, you can see the small green dots are green fluorescent labeled stem cell exosomes, which are very well uptaken by human donor fibroblast. And then exosomes are supposed to promote cell proliferation and neocollagenesis and neoelastogenesis. And this is the enhanced proliferation of HDF cells by exosome. As you can see in this slide, you can see that clearly exosomes can promote skin cell proliferation, and they can increase the migration of HDF. And this is another important function of a stem cell exosome. As I mentioned, inflammation might be the most important cause of aging, especially skin aging. So when we treated our exosomes to LPS stimulated macrophage, the cytokine level of IL-6, IL-27, and others, all the cytokine level were down-regulated very effectively. And this is one of our data about wound healing. As you can see, when we treated our exosomes to incisioned wound on a guinea pig, you can find that very effective re-epithelialization of those incision skin after 3 weeks. This is part of our biopharmaceutical business, especially I'd like to introduce atopic dermatitis. We have done a lot of studies, animal studies or in vitro studies. This is our first publication that we are, for the first time in the world, we proved the exosomes from AD-MSC can alleviate atopic dermatitis. On your right side, you can see we created how dust mite treated atopic dermatitis model, and we could see the thickness of the mice, atopic dermatitis model was decreased by the IV injection or subcutaneous injection for 3 or 4 weeks. And then we tried to check the level of a lot of biomarkers. So we found that exosome could be uptaken by overreactive Th2 cells. And then, for example, IL-4, IL-31, and other pro-inflammatory markers were decreased simultaneously by multiple treatment of exosomes. And this is a very new article published by ExoCoBio. We try to check if our exosomes could regenerate or repair a skin barrier effectively or not. Maybe later you can share this article with all of you guys. And then the most important findings we made is exosomes could promote de novo synthesis of ceramide or dihydroceramide, which are critical for skin barrier formation in atopic dermatitis model. We could see in electron microscope a lot of lamellar bodies or lamellar layers during skin repair process. And in addition, we could again the decrease of multiple pro-inflammatory cytokine level was decreased, and the TWA others are improved. And in this slide, you can see total ceramide was increased by the ASCE exosome treatment in a dose-dependent manner, while dexamethasone or steroid couldn't increase those ceramides. This is one case study of a canine case study. When we treated our exosome into this kind of dog, the systemic inflammation was gone completely for almost 2 years. This is one case study where we applied our exosome topically, and we applied ion toporosis, and the symptoms was gone very rapidly. And this is other studies on acute kidney injuries. And please let me say that our exosomes have been working very well for regeneration or anti-inflammation. So based on these scientific findings, we are trying to launch exosome-based regenerative aesthetics, ASC+, and maybe some of you guys know very well already. The main ingredients is exosome and other building blocks. And one of our partners in the United States named Bennett is selling well ASC+ to people. And this is the last slide for my first presentation. So exosomes. What is exosomes? Exosomes is the next generation regenerative therapeutics and aesthetics. And this is a new paradigm shift. We believe that adipose MSC is located in adipose layer, so which is the fundamental layer of our skin tissue. And all the our findings are very science-based, and exosomes are very effective and safe. This is a new prototype you could see in the near future. Thank you.
Byung, are you going to go through the hairs also?
Yes, I'm gonna opening my
okay, perfect.
My presentation. Okay, thank you.
Can you see this?
Okay, can you?
Not yet.
Okay.
Yes.
So
yes.
Can you see? Okay, this is my second presentation on hair products. So I have so please let me get started with this slide. Exosomes and hair for theory and rationale. So this is the hair follicle and ASC exosome. Please let me say that on your right side, hair follicle is located between the bottom of dermis and adipose layers. Okay. So here, the precursor cell is you can see the figure on your right side. The precursor is adipose stem cells, and during the hair cycle, the hair bulb is interacting with other adipose tissue-derived cells, including MSC or other cells, and they are communicating or crosstalk with exosomes actually. And in this slide, when you look at the figure on the left side, during the hair cycle, all those cells in the hair follicle or surrounding cells are communicating via exosomes, and those exosomes are containing beta-catenin or WNT proteins and other proteins for anagen or catagen too. And on your right side, I'm trying to mention that sometimes inflammation promote hair loss a lot. But as I told in my first presentation, exosomes, especially ADMS's exosome, could do dual functions to promote hair cycle into anagen, while they can reduce anti-inflammation to prevent hair loss. This is our theory named hair growth is CD and soil theory. Actually, this CD and soil theory came from Stanford University. You can find this video on YouTube later. But I'm trying to tell you all these cycles and aging are very related to stem cells or stem cell derived exosomes. So this is one of our key slides. As you can see, stem cell exosome can prevent autoimmune disease, inflammation, or aging. But while stem cell exosome can promote or regenerate epidermis or dermis or DP cell, hair DP cell, or hair shaft too. And this is our rationale. ExoCoBio's exosome-based rationale is shown in this slide. So for skin rejuvenation and hair loss prevention, stem cell exosomes can work quadruple in quadruple function, can do quadruple functions. The first one would be regeneration. The second is anti-aging. The third one is anti-inflammation. The last one is wound healing. As you very know well, testosterone can convert into DHT, and the DHT can make a hair follicle smaller and smaller, and they can induce aging, inflammation, or skin damaging, which lead to hair loss totally. But for each step or for each process, stem cell exosome can do one of those four functions in terms of hair regrowth or hair loss prevention. So this is the profiling of the proteins or microRNA profiling actually. So as I mentioned, in our exosomes, there are a lot of good factors, including proteins or microRNAs for hair cycles or DPC anti-aging or DPC anti-inflammation actually. So you can in this slide you can see hair follicle or hair cell proliferation, anti-aging, anti-inflammation, regeneration, and wound healing. For each requirement, exosomes, our exosomes have a lot of good molecules. This slide shows that the cellular uptake, especially by human thermopapillary cells, they can uptake exosomes very easily, and then HDP cells can proliferate. In this slide, I'm trying to show that senescence protection effect via stem cell exosomes. In this slide, we irradiated HDP cells to UVB, and then we treated our exosomes pre and post treatment. So in this slide, our exosomes could reverse or stop senescence of human thermopapillary cells. So this is our new product named HRLV. It contains 10 billion particles of ASCE exosomes, including other building blocks or the function of soil. This is the world's first lyophilized exosome regenerative complex for scalp and hair. And so what is the biggest advantage of our product? Actually, exosomes are cell-free product, and it they have a highest potency, and then they can do at least dual function, regeneration or anti-inflammation. So this is, we can say that this is our next generation technology for hair. And from this slide, we thank you about the contents of this slide, Metspharma and Dr. Ashley Barker. So in this slide, Dr. Ashley Barker applied our exosome just one day before her transplantation. They could see a lot of nice effects, such as unbelievable no leak, or faster wound healing, less inflammation, less pain. And this is the all these slides came from Metspharma. So maybe you can share your experience later. And for every patient, every cases, we could see very nice hair loss or hair regrowth effect. And one interesting case is this patient was suffering from seborrheic dermatitis, and for this patient also we could see nice results. And one of the exosomes advantages is they can apply to female too. This is the video treatment, and this is this slide came from the United States. One of our patients, they applied our exosome to rejuvenate scalp. And you can find a lot of information of exosome on hair loss actually. Oh, so this is the last slide, and then we believe that our exosomes for hair is very nice. Thank you.